All right, so I think we'll get started. So like Elizabeth was saying, my name's Amelia. I am a senior nursing student here at Carroll, and I'm originally from Portland, Oregon. So today I'm going to be taking you guys through the fourth floor nursing facility. It was recently finished and we are still underway with a few last minute projects, but it already looks so awesome. And then at the very end, we are going to have a Q&A. So if you could just hold your questions until the very end, I'll be sure to touch on all of your questions that you have, and then just chat them to me through the little chat to Amelia. All right, so I will show you guys. This is our fourth floor nursing lab. This is what it looks like when you first get up here. And as we come in here, we're going to go into our assessment lab for the first part. So this lab is used primarily for sophomores in their first semester of the program. As you can see, it's kind of set up like a little clinic, as you would see in a doctor's office, with multiple different stations. And in the middle here, we have kind of a debriefing circle that we use just to talk about our lab worksheets that we have or about tests that we have coming up. As you can see, we have the best views on campus of Helena. And then we also have this super awesome whiteboard paint that we use in a lot of our classrooms here on campus. And so we get to utilize that entire space right there of the wall. So I'll kind of go to one of these stations so that you guys can get a closer look about what we have available to use. So this is where we really learn how to do our head to toe assessment our sophomore year. So as you can see, we have the different blood pressure cuffs, a thermometer, gloves, a sharps container, and then just the patient bed that we use. We have a lot of pull-out systems here, so we have different things available to us. Oh, but they're empty right now. But we get to learn basically how to do a head-to-toe assessment week by week. So we start with the head, and then we move downwards. And then at the very end of the semester, your final for this lab is to do a head-to-toe assessment, complete all the way through by yourself on a friend. And it really helps build your confidence with being able to do that kind of assessment because you will be using it in your day-to-day as a nurse. So that's just one final look at our assessment lab here. We also utilize this space as seniors, just the tables mostly for our capstone debriefing. So capstone is our senior spring semester assignment, where we get to kind of choose what area that we're interested in to kind of explore a little bit more for 120 hours. This is kind of more of our space here. And each week we get to meet with a professor to kind of talk about our experience, talk about what we learned, and go from there. So we have a lot of professor offices that are just off to the side here. Our professors are super accessible and they're very personable, excuse me. So they really get to know you. You kind of get to become a little family with the nursing cohort here. This is kind of just another lab or lounge area that we have that's newly built. And we'll go into our simulation lab here. So feel free to ask questions at any point through the chat. I just won't be able to answer them until the very end, but I'm glad you guys are here today. So here's our simulation lab. We just got 7 new simulation mannequins. This is one of them. Her name is Anne. They're super great because it kind of gives us the opportunity to practice before we go into the real world and have actual human patients. So as you can see, we have active headboards for all of our patients in here in the simulation lab. You can turn on the oxygen, you can turn on suctioning. We have just a bunch of different things. These do actually turn on, so you can like turn the oxygen all the way up and hook up a nasal cannula to them. But they're super awesome. Their eyes can open. They can kind of track you with their eyes, track movements. They will do heart sounds and lung sounds and pulses. You can see we have IV practicing on some of our simulations. And then they also can do like temperature of the skin. We can practice doing different scenarios with our simulation mannequins. Here's one of our med carts. It's just good practice to have because this is what you're going to be utilizing in the real world as you go from room to room with your patients. This is just another thing that we have to practice on with PICC lines right here and then central IV lines right there as an example. We call this guy Chester Chest. And here's George. He's kind of our OG simulation mannequin. He's been with us for a really long time, and he's just an awesome mannequin that we get to utilize. So as you can see, they kind of have a monitor with them. So it's really set up as it would be in a hospital. So we have like a patient curtain. We have medicine carts that you can see right here outside of his room. And then we will go back this way to see some more simulation mannequins. But I want to show you guys this cool feature that we have right here. This is our observation lab on the other side. So it's a one-way glass. So our professors will actually stand behind that glass and they will watch us as we go through our simulations, kind of assessing our knowledge and making sure that we're doing things the right and safe way. So here's another section of our simulation lab. This is one of our pediatric kids that we have. So as you can see, it also has a headboard, has our gloves, our sharps box, a monitor to the side here, a little side table, and then we have like a patient curtain in between all of our simulation mannequins. So it's set up how we would really see it in the real world. This is Lucy. She's one of our mannequins that can actually give birth. She's super awesome. This kind of that you can see here on her arm is what's called an AV fistula, which they use for dialysis. So another thing that we can practice on her. And as you can see, we have the observation that goes all the way through the lab so that they can see the entirety of the lab that we have. Over here is more of our like nursery that we call. So we have a little simulation mannequin baby. This is one of our new ones as well. Super great. I personally have not gotten to use them yet, but they will be a great addition for you guys. And then here's another one. So as you can see, they're kind of set up how they would be in a little bassinet, or this is an isolation heater. Sometimes they're called giraffes or pandas, but they'll mostly be utilized on the OB floor or in the NICU. And then these things are super cool too. They're kind of just privacy doors. Sometimes we set them up if we have skill checkoffs, so you can kind of just have privacy from your other nursing peers as you're getting checked off through things. It kind of helps with just nerves and whatnot. So we're actually going to exit this lab now real quick. So we're out to the hallway. This is kind of just another view of the things that are set up. I'm sure some more things will be being set here as we get underway with construction a little more. But there's that lounge that I showed you guys a little earlier.
Brian, he was there's a lady in the grocery store, the full hazmat.
And then we're going to go into our observation area now, which is on the other side of that one-way glass that I was showing. So this is where our professors will be set up. As you can see the lab and my reflection. See the lab through these glass windows. This is where our professors actually run the mannequins. So as you can see, they have headsets. They can talk through the mannequins as if, you know, the mannequin was actually speaking. This little device lets them set their heart rate, their temperature, their blood pressure, all of those things. And then if we give them, say, a medication, then our professors will alter all of those things based on how the medication would actually react in the body. So this is more of our simulation lab. This is actually our skills lab on the other side. So this observation lab looks into all of our labs that we have up here on the floor, except for the assessment lab. So we're going to go into the skills lab in just a moment, but I wanted to show you guys this observation room first. Okay, so now we're gonna be entering our skills lab. And this is what it looks like when you first come in. So we have kind of our IV kits set up. We have an ambu bag. We have, this is kind of the table that we practice a lot of our IVs on. And then we have some more mannequins. These are kind of our older mannequins that we've had for a few years. So but they're great for practicing like tracheostomy care, catheters, wound care, IVs, and then just overall a head to toe assessment on them. So they also have the headboards with the suctioning and the oxygen. We have hand sanitizer at every station, so you sanitize in and you sanitize out, just to form that good habit that you're going to need to be working in the hospitals. We have more medication carts, a great view of Mount Helena right there in our backyard here at Carroll. We have IV pumps. You guys will get to learn those, how to run them, how to set the rates, and how to change bags, and how to hook up IVs to their line. This is another one of our pediatric kids. As you can see, he has a little extra arm on his side here, but that's so that we can practice IVs. Some of the mannequins don't actually have skin that allows for IVs to be placed, so we'll just have practice arms every once in a while. But it's a great skill to be able to practice, and we practice it quite a lot before we go and practice in the real world with it. This is some trach care that we're doing. It looks like he's receiving some oxygen here with a tube. And then we have just some of our materials that we get to use, and another Chester chest. Over here is some of our skills that we'll practice. So this is the IV practicing station. As you can see, we have fake blood, so you will get a blood return, or you're supposed to, when you set your IV in place. Then we have the whole kit set up here and a sharps box. And then with every lab, we have a way to debrief. And I think that's a great way to just be able to talk about what went well, what you need to practice, what maybe you didn't feel so confident on. And it's just a great way to get feedback from your professors. And then this is the observation room that I was showing you guys earlier. So I have one final lab that I want to show you guys. This is probably my favorite lab. It's called our holistic lab. And holistic just means taking care of your whole mind, body, and spirit. And I think our facility, like our nursing faculty here, really do a good job of trying to put that into practice, because it's always good to have self-care, and you're always going to need it. You're always going to need a way to be able to handle your stress, or take care of a difficult situation. So these are some of the skills that they're teaching us how to use as we're starting in our nursing program. So as we walk in, there's some plants. This is a weighted blanket, which is honestly my favorite thing. It's just so comforting. And we have some really comfy chairs. We have some aromatherapy. We have a happy light, which helps boost your vitamin D levels. And then we just have some great books over in this section. Chicken Noodle Soup for the Soul. It's always a good one. And then we have some massage things. Another little massage thing. And then we also have some biofeedback, which is a way that you connect up to it through a little oxygen monitor, and you try to calm your heart down and calm your breathing and take deep breaths, and it allows you to see a result of that through the biofeedback. So this kind of concludes our lab space that we have. I'll just do a final walkthrough with you guys real quick of what the floor looks like now. It looks so amazing. I'm so excited for you guys to be able to utilize it. And then I guess another thing I would just mention is that our professors will literally take any time out of their day to be able to talk to you guys, whether it's about academics or just about life. They really will go above and beyond to help you guys with the transition, or if you're having difficulties in any subject. They really just want to make sure that you guys are successful in all ways possible. So this kind of concludes that portion. But if you guys have any questions, please feel free to chat them to me and I will touch on them, because this is kind of our question portion of the tour. So feel free to send those in and I'll start answering those in just a minute. Okay, can everyone still see me okay? Okay, so I'm gonna start answering questions now. So the first question that we have is how many new mannequins do we have? So we have 7 new ones. We have some babies, we have some pediatric, and we have some adult ones. And then the second question is, do you guys do your clinicals at Carroll or do you go to nearby hospitals like internships? That's a great question. We actually do a little bit of both. So we do some simulation here on campus and we learn all of our new skills before we do go out into the hospital. But your very first semester of your sophomore year, you will learn all the skills to actually be a CNA level of that kind of skill set. And then for 2 weeks, you will actually go to St. Peter's and you will shadow alongside a senior nursing student that is there for their clinical. Otherwise, we have clinical at the Montana Mental Health Center here in town. That'll be either your sophomore or your junior year, depending, because we do half there and then half on the OB floor during that time, and then you flip-flop. So you'll do OB floor, which is care of the family, or you'll do the mental health facility during your spring semester sophomore year or your fall semester junior year. And then from there, we go to the medical surgical floor for 2 rotations for 2 semesters. And then your senior year, you kind of get to choose what you want to do. So a lot of people either do a ICU rotation for their capstone, or I did the NICU in Missoula. So you kind of get a lot of different opportunities. Some people did oncology. So it's really based around what you would like to do and what you have a preference in seeing more of. The next question is, do you have a job lined up already? I do not. I am still looking at a few places, but the other difficult part is a lot of my applications for residency programs don't open until May. So it's kind of a waiting game. Some of my peers do already have jobs lined up. One of my roommates actually just got a job at Vanderbilt, and another one of my friends got a job on the oncology unit for Vanderbilt. Some are working, already got jobs at the Billings Clinic. So there's a lot of different opportunities, and it just depends on what you're looking for and what unit you're looking to work on. Question, if you're in pre-nursing, do they also get to use the lab portion? So pre-nursing is kind of your freshman year, and that's when you'll take the prerequisites. Everyone will be in the same boat, whether you're direct entry or pre-nursing. You'll all take anatomy and physiology and some psych classes and some chemistry and biology classes. Sorry, not biology, just chemistry. But we do have an anatomy lab on this same floor. It's just kind of down the hall a little bit. So you don't necessarily use this lab space your freshman year, but you will for sure your sophomore year once you're in the program, if that makes sense. Next question, was it easy logistically to go to Missoula? Yes, just because I had a housing situation set up and I had a car, but this is my first year having a car on campus. I didn't really need it to get around town before. It was super easy to either carpool with people to clinicals or just walk places in town for like fun activities, but I never had an issue getting to a clinical site without a car. My sophomore and junior year, you kind of just have to ask people that are in the same rotation as you, and you'll be able to work it out just fine. But with Capstone, you get the option to travel or not travel. So if you don't travel, then you'll be somewhere here in Helena. And if you do want to travel, then you can pretty much go anywhere in the state of Montana that we have a contract with that hospital. So a lot of people did go to Missoula to either St. Patrick's or to community medical center. Some people went to Great Falls, some people went to Butte, to Billings, to Bozeman. So it really just depends on what unit you're interested in, and also if you have accommodations set up. Do you guys have any more questions? Feel free to send them to me, or you can unmute yourself and ask them. You can also ask me about my experience here as a student, about the program, about the labs, if you have any more questions. I'll just wait a few minutes to see if any more questions roll in. Okay, so I got another question. Can you share one of your favorite nursing classes? One of my favorite nursing classes has probably been my simulation lab, and that goes kind of hand in hand with your second rotation of illness across the lifespan. So that's your fall semester in your senior year. And you really just get to learn a lot of different situations with the mannequins. You spend countless hours in the simulation lab, and you get assigned to a group of 4 or 5. I had a small group of 4, and you just get to learn the roles of being a leader, the roles of being a recorder for the situation, of being like head and airway, or being the vital sign or medication person. So that everyone kind of has their own role within the scenario. And then someone either writes the simulation or your professor will write a simulation, and you have to go through it just based off of what you see, what the lab results are, and then you have to come kind of to a diagnosis, which is a little above the qualifications of a nurse, but it's just helpful to know those things going into the real world so that you can recognize them. So we learn how to crash someone, we learn how to do the crash cart, how to do compressions, how to, there's just a lot of other things, how to go through anaphylactic shock. So that was definitely, I think, the class where I learned the most in the shortest amount of time, because you kind of just thrown into it, but it's one of the best learning experiences I've ever had. Another question, did the school help with finding accommodations? As I was coming into the program, they made it seem as if they were going to be helping with accommodations, but when it came down to it, it was mostly just, okay, do you have someone that you can stay with? Are they okay with you staying? So it's mostly like family members or friends or someone that you know that's okay with you coming and staying. I did have a few professors though who said, if it came down to it and if I really needed help, then they could reach out to a few people that they knew. But they mostly prefer that you already have something set up on your own. Otherwise, it gets just a little tricky and it's a little harder work for the professors because they already do a lot for us. Another question was it difficult transitioning into college and finding a new normal? That's a great question. I came out to Montana. Like I said, I'm from Portland. I had never really been out of the state before, to live at least. Never really been on my own. And I had never really been to Montana. And I didn't know anyone else that was going to Carroll from like my high school or from Portland. So that was definitely a big stepping stone. But I think the easiest way to get over that transition is to kind of go outside of your comfort zone and really get involved with a lot of the activities that they do the very first week on campus. Like they do a big barbecue, they do a swing dance, they do a lot of different activities. I did the whitewater rafting for freshmen my very first year, and I like met people that I probably would never have met in the first place. But I think all of those things really helped me to push myself outside of my boundaries and what I'm comfortable staying in, and really just get to know people. I mean, you're coming in, everyone's in the same boat, everyone's, new, everyone has never been away from their parents really for this kind of a long time. And so it's just nice that everyone's kind of in the same boat, if that makes sense. So it's a little easier. And then I think just like going through the routine of school helped with the transition a lot, because that kind of really helps set a day-to-day normal. And so just following through with that, maybe getting a job or getting involved with an extracurricular could help you as well to find that new normal. But I would definitely recommend like stepping outside of your comfort zone in a way to meet new people. Another question is, did you travel home for all breaks? That's a really good question. I like to, because I missed my family quite a bit. But there was definitely trips or breaks that I didn't make at home. For like an Easter weekend, it was just too short because I usually drive home to Portland and it's about 10 hours. So it was a little bit of a stretch just to be home for a few days. But there's always a good sense of community here on campus, and most of the time people are staying on campus as well. So it's never deserted, you're never alone. You don't have to worry about being stuck inside of Guadalupe Hall, which is our freshman residence hall, all by yourself. That's just never gonna happen. There's always gonna be at least another person with you, or your RA or your peer minister. But the only breaks that they shut down campus is for Christmas break, because it's like a month long, and then for the summer break. But people do stay on campus every once in a while. If they're like, say, working in town, then they can work through accommodations with residential life to be able to stay on campus. Another question, how long did you stay in Missoula? I was in Missoula for half of the semester, but we actually had to travel back to campus for Tuesday and Wednesday because that's when we had classes as seniors on campus. So I would usually go to Missoula for like Thursday, Friday, Saturday, and Sunday, and I would come back. I actually had to work night shifts, so I would work that Sunday night, and then I would sleep for a little bit and then drive home on Monday because we didn't have any classes, and I could take that whole day to recover and do homework. So it was really easy to kind of make that transition back to days for taking classes. But it was just for a few weeks. Your only requirement for that is 120 hours of clinical experience. So I was able to do that with 12-hour shifts in about 10 days, realistically. And then the next question was whitewater rafting before school started. I think it was like the very first weekend or the second weekend of school. We have a Carroll Adventure and Mountaineering program, which we call the camp program, and they put on a ton of outdoor activities. They have one just about every week. So they have like a freshman backpacking trip, they have a freshman whitewater rafting trip, and then they have a ton throughout the year. They have like different hikes here and there. They have mountain biking trips, fly fishing, floating the rivers. And then for spring break, they always do a big trip down to Moab, Utah too, which I actually did last year and it was super awesome. But it's just a great way to be able to get out and do something and meet new people that you maybe wouldn't have met otherwise. This year, however, for you guys, I believe they are doing kind of a pre-orientation backpacking trip. So you kind of get to go out into the wilderness the week before orientation starts here on campus. So you kind of get to like backpack and hike through the mountains in the wilderness here in Montana. I can't remember the specific name of it, but it's kind of a great way to just kind of ease that transition into school, maybe do something fun before you have to start right into everything and get to see how beautiful Montana is out here. Okay, another question, is Missoula the only place where they have a NICU and a pediatric opportunities? No, they have some opportunities up in Great Falls, which is a little north of us, and then they also have some in Billings, which is about a 4-hour drive, but I had a friend who did the NICU over there and really enjoyed it. But yeah, Missoula is another one. Most of the Helena babies or pregnancies that were gonna need a NICU did come out to Community Medical Center in Missoula. And Missoula is just an hour and a half away from here, so it's not too bad. So there are a lot of different opportunities, and the pediatric was also great at Community Medical Center in Missoula, but there's other opportunities in Great Falls and Bozeman and all over the state for that. And it looks like I just got a little feedback about the pre-orientation. There's going to be 3 different options, and you guys will be receiving emails about that in the next few weeks. So look for that if you're interested. All right, so that kind of concludes all of our questions, and I think I'm going to wrap up unless anyone has last minute questions. If you do have any more questions that you feel weren't answered in this session or you need answered, you're more than welcome to reach out to the admissions office, to Elizabeth Zimmerman, and then they can direct you either to the nursing program or to your direct admissions counselor. So thank you guys so much for being here today. I really appreciate it. Hope you guys all stay safe and healthy through this whole safety part of the COVID virus. But we look forward to hearing from you guys. And if you, again, have any questions, please feel free to reach out to us. But I'm going to conclude this. Thanks so much, guys. Bye.